Which of the following is not an oncogene? That means which is not an oncogene. Here are the options. Options are the RAS, MYC, SIS, Ki67, ERB, B gene. So which of the following is not an oncogene? So first of all, what is oncogene? Oncogene is a tumor promoting or tumor producing gene. So first of all, see the oncogene. What is the oncogene? The oncogene, they are cancer promoting gene. That means they are cancer producing gene, and it is derived from the normal gene. That means a gene, proto-oncogene, what actually it does it actually regulates the normal growth pattern of a body. But when this regulation is hampered, that means the function of the gene is hampered and overproduction occurs in different area and causes the cancer. The proto-oncogene plays important role in physiological role in the cellular growth. So in case of the cellular growth, this proto-oncogene plays a definitive role. But when this proto-oncogene is mutated or destroyed in this condition, what occurs, the cellular growth is hugely increases, and they are implicated in the development of 20% of the human cancer. That means the mutation is responsible about 20% of the cancer. And the proto-oncogene may become oncogene via the following process, such as the mutation. So first of all, the mutation, which is the most important point, then chromosomal translocation, then increase protein expression. So these three important procedures, it can causes the production of the oncogene. That means normal proto-oncogene, it may converted into the oncogene by mutation, by chromosomal translocation, or increase protein expression. Only one mutated copy of the gene is needed for cancer to occur a dominant effect. So when there is the dominant effect or dominant cancer in this condition, one allele or one copy is enough. But in case of the recessive condition, two genes must required for development of the cancer. Here showing the classification of the oncogene. First of all, the growth factors such as the cis, transcription factor MYC, receptor tyrosine kinase RET, cytoplasmic tyrosine kinase SRC, and regulatory GTPase, which is the RAS. So they are the oncogene. That means cis, MYC, RET, SRC, RAS, they are the oncogene. That means they causes cancer. So the tumor suppression gene, another important phenomenon or another important term, but that means this gene is responsible for suppression of the tumor gene. That means the gene which is responsible for tumor formation, it suppresses this type of the gene. That means the repress cellular proliferation of the normal cell. And this mutation of the germline may cause the renal, colonic, breast and bladder and many other cancer also. One of the best known tumor suppressor gene is the p53 gene, and the p53 gene is a very, very important gene, and this gene is known as the guardian of the genome. That means it regulates almost all function of the other gene. The p53 gene offers protection by causing apoptosis of the damaged cell. So when a cell damaged, so in this condition we don't want to keep this cell, so the apoptosis occurs of this cell. And other well-known genes include the BRCA1, BRCA2. On the other hand, the Ki67, it is the proliferative marker and it is used for immunohistochemistry. So it is not oncogene. The Ki67, it is proliferation marker, but it is not the oncogene. And the positive is marker of the malignancy. That means the Ki67, it increase in case of the malignancy, but they are not the oncogene. It is not itself an oncogene. That means it is not an oncogene. So what is not an oncogene? It is the Ki67. Other options here such as RAS, MYC, SIS, ERBB, they are the oncogene, but the Ki67, it is the growth promoter.